So we're talking about the number 4 killer strokes or CVAs, and we're doing a 4-part series, which we've been doing on the different diseases. Um, and so we're talking today about treatment and why is structure function care so important in the treatment and prevention of strokes?
Yeah, of course, for the emergency, the disease care is the best. But really, when you're talking about prevention, only structure function really provides that. Because, when you're talking about all these nutrients, that's not really the job of a disease care doctor. That's really a job of the structure function. So we sit there and do the testing to find out, what is it that you actually need. And we can get that down to exactly where in the Krebs cycle that the process is off.
It's interesting too. People will say, well, supplements are just like drugs. You have to, you're, dependent on it. What do you say to someone that makes that comment?
It's different from drugs because what you're doing is controlling the symptoms. And once you've established it, then you're
with drugs, with
right,
prescription.
Like when I first had my incident with the bite that I had, I was taking just on natural anti-inflammatories. I was taking 45 of 2 different, so 90 pills just on anti-inflammatories. I'm not taking any now.
Yeah.
So, and I was averaging about 45 pills a day, which, was a lot. And of course, I never complained about it, did I?
No comment.
Yeah. It's like, if I have to choke down one more, but I knew how important it was.
Right. And you knew it wasn't forever.
Right.
Right.
And now
you're down
15. So I'm down to 15. But, it takes a while to heal. And that's the thing that, you try to get across to people.
And there was no side effects.
No side effects, no. And what it is basically it's concentrated food. I've had people come in, sit there and say, I just want to do it through my diet. If these are concentrated foods, what do I need to do? So I said, okay. So I wrote out everything that they need to do, and they looked at it and said, I'll take the pills. It was impossible. And
right.
it's concentrated foods. That's why we put them in there, so that you can get, what you need.
Yeah.
And so it's actually easier to take the pills than trying to do it through your diet. You should have a good diet. It's not something, but it's beyond. If you're trying to really supercharge your system and really get the healing going,
support it.
Have to get on supplements. Concentrated foods. That's the only way that you can do it.
Yeah. Well, let's talk about the different treatments. We talked about the ECP, the nutrients. Let's talk about diathermy and why that's so important.
Diathermy is excellent because it actually can help to regenerate. So diathermy, we can use it on the liver, spleen, and like for cholesterol, it really does wonders because a tremendous amount of cholesterol is actually made and processed. So it's made and destroyed in the liver. So if you're off on your cholesterol, as far as monitoring it. So if everything's working right in your system and you need a lot of cholesterol to actually heal yourself. So the body will actually make the cholesterol that goes out and then repairs. And then you make quite a bit of HDL, high density lipoproteins, to actually, they're the ones that bring it back in to get reprocessed and then go back out. And if everything's working right, you keep a good ratio. So it doesn't matter if you have a 300 cholesterol, if you, because you need that for repair is what your body's saying, but it's going to have you at least at 100 HDL, and then there's no buildup of fats in the arteries. Do you see what I'm saying? So if the body's working right, it can actually adjust that. Now, if the body doesn't need a lot of repair, it's going to keep it at 150, somewhere in there as far as your total cholesterol.
Okay. But what does this have to do with diathermy?
Liver.
Get you back to the treatment.
Remember, liver actually is the thing that actually controls that. So the liver makes the cholesterol and how much goes out, and also makes the HDL. So if it's not balanced, it's the liver that's the problem.
And the diathermy does what?
The diathermy gets blood in there and lymphatic tissue, so the process actually works. So as we're looking at the liver, the liver enzymes, they actually heal. The fatty liver actually reverses because you're getting blood and lymph in there, and actually starts the whole healing process.
And the diathermy's magnets.
Big magnet. And basically what the magnet does is it goes in there and it changes the polarity of the arteries and the lymph system.
Okay.
And so it opens it up, and you get this flush in there. And when you get that flush, it's a healing. Remember, you got to have blood going for anything to heal.
Right.
And so this will actually, this will get it going. And it changes cholesterol levels. It balances out the LDL and HDL. So you have a good balance, good healthy balance. And it does a tremendous amount of things. But so it's great. And we use it for the kidneys. So it's a magnet. It gets the blood flowing, just like it's like another ECP. You know what I'm saying on that? Where it increases the blood flow and the nutrients, and as it does that, it aids in healing. So anything that helps by moving lymph system and moving the blood, diathermy helps. We use it so much.
Well, let's talk about acupuncture too. Doesn't acupuncture help with lowering blood pressure?
Very quickly. One, there are certain points that are specifically for hypertension. And then also it changes the hormone balance. So cortisol, there's hormones of stress and there's hormones of relaxation. Not to get too complicated, I would divide those up into cortisol and oxytocin. So cortisol is where you get all hyped up. It's very good if a tiger's chasing you. You want a lot of cortisol. If you're constantly feel like you're being chased by a tiger, the cortisol's up there. It's going to throw up all your minerals. It's going to cause free radical pathology. It's going to kill you eventually.
So the acupuncture helps.
Acupuncture switches you and actually reduces the cortisol level.
Puts you in that parasympathetic.
Puts in the parasympathetic. Oxytocin goes up. It's just like we had a patient that was very funny. She was scared to death of needles, and I said, "Oh, most people fall asleep." And her big thing is she hadn't slept well for 3 months, and none of the medications were working. And her daughter sat there and said, "Well, that would be a miracle." And so, I sit there and said, "Well, let me know if there's a problem." She didn't even feel him going in. And we came back in to check on her, and her daughter was like, she's snoring. What is this? Did you put drugs in there? And of course, no. But it just kind of switched the whole switch. And after we do that for a little bit, it changes the physiology.
Well, and I know too, being in with the new patients with you and scribing, when we do the ANS test, a lot of people have vagal nerve issues.
Oh, so many have vagal nerve issues.
And a lot of times we have a great handout and we review the vagal nerve exercises with the patient.
And nothing works right if the nervous system isn't working right. And that vagal nerve is huge.
Right.
Matter of fact, a lot of people come in with POTS, postural orthostatic tachycardia, and basically that's coming from the vagal nerve. A lot of hypertension that's not responsive to medicine is because it's the nervous system, not the physiology of the body. So what you have to do is to fix the nervous system. One of the most important things is the atlas adjustment.
Right.
If you don't have the atlas fixed, you're never going to fix. You're never, ever going to fix the vagal nerve, and you're never going to get the parasympathetic and sympathetic balance, no matter what you do.
Well, I want to make sure we talk about the other things we have in our rehab department.
Rehabilitation.
We work with balance. So someone, that has had a stroke probably needs to work on their balance, but also cognition.
Cognition, yes. Yeah, we have a very excellent program along those lines that can make a huge difference on balance. And
Mm-hmm.
once you actually have a stroke and you lose your balance, that sets you up for a whole bunch of other problems.
Mm-hmm.
It ages you. The
Mm-hmm.
falls, oftentimes, if you get a really bad fall, it shuts down, it causes you to die early.
Mm.
Huge expense. And then you keep on hitting your head, and that's the last thing you want to do.
Right.
So, very important to get your balance back. And then also the cognition. So,
Mm-hmm.
we can, after a stroke, we can actually train people to get their cognition back, make a really big difference.
Mm-hmm.
And also, as you're getting the balance and getting the cognition, that actually helps you to not actually, because the brain's working better,
Mm-hmm.
uh, the blood flow is actually uh, improving. That actually was preventative and a rehabilitative type of thing.
Right.
So
Right.
it's amazing as far as how you can put all that together.
Mm-hmm. Well, we have a little under a minute. I want to make sure you cover anything else.
Well, the main thing is that we always like to think of is a lot of people don't think of us for strokes.
Mm-hmm.
One for prevention, and then two also for rehab along those lines. And looking at a good structure function office where they can actually look at the nutrients, look at the risk factors, and then have a program that can actually reverse this and make a big difference.
Mm-hmm.
And we can do that. I mean, there's a lot of different things that we have, and we have a very high success rate, which is what people are looking for.
Yeah. Well, thank you, Dr. Prather.
Thank you, Lisa.
Very informative.